In this video, I'm going to show you how to set up your desk chair in order to decrease hip pain from FAI and labral tears. I'll also provide some options for what type of chair might be best for you, with pros and cons for each. Finally, I'm going to give you some tips on managing FAI and hip labral tears, especially if you have to sit for several hours a day. But first, comment down below with what type of chair you sit on while working at your desk. Hi, I'm Dr. Nicholas Mercer, physical therapist and your guide to a pain-free life. As we transition to a society primarily of desk jobs and computer work, we also see pain levels increase. Chances are you have to sit for several hours a day, either for your work or school. And when you have FAI and labral tears, this position can really aggravate your hips, especially in the front. Even worse, as the hips get more irritated, staying active becomes more challenging. Fortunately, there are several changes you can make to your chair to limit the pain. With FAI and labral tears, typically flexion, internal rotation, and adduction of the hip will cause pain. With sitting, our main concern is hip flexion. So let's take a look at how we can open up the hip flexion angle while sitting. If you're using an adjustable height chair, the easiest way to get relief is to ensure your hips are higher than your knees with your feet flat on the floor. This opens up the angle of the hip so the femur and acetabulum are not irritating the labrum. If your chair is not adjustable, you can still open up the hip flexion angle. Adding books or pillows, for instance here I have a foam mat, under your hips will elevate the hips over the knees. In addition, if you keep your hips away from the backrest, engage your abdominals, and lean your upper back into the backrest, you'll see the hip angle open up, similar to increasing your chair height. If you have one hip that's the main problem, using a chair without armrests will allow you to bring that hip over to the side of the chair and open up the hip angle by bringing that leg back. Standing is also a viable option to open up the hip angle. However, staying standing all day causes fatigue of the legs and lower back, which can also lead to hip and back pain. You can meet in the middle by using a high stool and sitting on the edge, keeping the abdominals slightly engaged. This will limit fatigue in the legs and the back from standing while allowing a more comfortable hip flexion angle. The best option out of these, though, is to alternate between as many of these positions as possible throughout the day. The best position is the next position. Now, let's cover different types of chairs. First, let's look at the standard rolling office chair. These chairs often come with built-in lumbar support, comfortable seat material, and several adjustment options. They also allow you to be more dynamic, especially helpful for people who have to move short distances frequently throughout their day. Unfortunately, the instability of rolling chairs can make you want to cross your legs instead of keeping your feet flat on the floor. This is not an ideal position for people with FAI and labral tears. A stable chair with no wheels is also a viable option. The stability of the chair allows a variety of sitting positions without turning or rolling. However, most of these chairs do not have adjustable heights, so getting the hips above the level of the knees can be challenging if the seat isn't high enough. A high stool can fix the problem of a seat that's too low. However, doing a half sit or lean with the high stool can get fatiguing, and sitting fully on this type of stool does not allow the feet to rest flat on the floor. One type of chair we haven't talked about yet is the yoga ball. Yoga ball encourages the user to keep their feet firmly on the ground and use their abdominals to stabilize the spine and the pelvis. However, it is nearly impossible to adjust the height of the yoga ball. Also, if the user does not have adequate core control, they may rely on their hip rotators to stabilize their lumbopelvic region, which can make the hips more irritated and painful. Regardless of the type of chair you use, there's one thing that you can do to help decrease and prevent anterior hip pain when sitting. Most people who sit for several hours a day tend to go into anterior pelvic tilt, which closes down the flexion angle of the hip. Performing posterior pelvic tilts utilizing your abdominal muscles is incredibly effective at opening up the hip flexion angle without having to adjust or switch out your chair. First, think of the back of your spine lengthening. Then simply pull your belly button in and allow your back to round slightly. You should feel your pelvis tilt back slightly and your abdominal muscles squeeze. Hold for a few seconds and do up to 10 repetitions at a time. You can do this whenever you start to feel your hip pain creep up, or set a timer to do it every hour or so to prevent the pain. Ultimately, the type of chair and position you choose is going to depend on your needs and your specific hip problems. What should be the most consistent among everyone watching this video is frequently changing positions. Remember, the best position is the next position. I hope this video helps you survive your workday with less pain, or even just enjoy sitting at the dinner table with your family. Be sure to comment below with what chair you prefer to use, and share this video with a friend who suffers from hip pain. Thanks for watching.